and a journalist, Oiza Adaba, and a professor of pediatrics at Albert Einstein College of Medicine, Suzette Oyeku, joins me via Skype, both from New York, to discuss this development. Good to have you both on the word now. Let me start with you, Oiza. Now, let me start with you, Suzette. Now, there are about 74 million children which are lesser than 18 in the U.S. And now the New York Health Department has reported cases of this lethal inflammatory syndrome in children. What more can you tell us about this?
So we've begun to see a few cases of this. So far in the New York City Department of Health has identified 15 cases, 15 patients ages 2 to 15 years of age who've been hospitalized between April 17th and May 1st. And these, as you alluded in the lead into this piece, have symptoms that are compatible with Kawasaki disease. So typically they have fever, they may have rash, they may have abdominal pain, vomiting, and diarrhea. Respiratory symptoms were actually reported in less than half of these patients. And about 4 of these children had positive PCR testing for COVID-19. So this is something that, as a pediatrician, that we're looking at, and that if patients develop these symptoms, for us to just be mindful of it in the context of coronavirus infection.
All right. So from the test, from the test done, 10 of these children had coronavirus. But when you look at this, is there a medical explanation for this yet? Because we are also hearing that this has been reported in countries like Britain, France, Italy, Switzerland, and Spain. So is there a medical explanation for this yet?
So just want to correct one thing. So actually, there's 4 out of the 15 are tested positive in terms of PCR. 10 tested negative. So just want to clarify that point. So right now we don't have a full understanding as the reason as to why this is. We think that the inflammatory response that we normally have in response to any infection has it's just been heightened in the context of coronavirus. And so that has led to attacking healthy tissue, particularly the heart and the lungs. But we don't know fully why this is happening in some children and not happening in others. Because overall, most children who have been affected with the COVID-19 infection, most of them have had a pretty mild course. And that may be just fever, cough, runny nose. There's a small subset of children that we're beginning to see this inflammatory syndrome. And so as we get more cases, we'll be able to better understand what the reason for this and better understand what precautions we could potentially take.
But how is this complicating efforts at containing the spread of the virus?
So I think for now, it's I'm in New York, so we still are on pause. And so we still have stay-at-home orders. The children are not in school right now, so they are at home. I think for us, the biggest thing is we know that children can sometimes not have any symptoms at all. And so what we're telling folks is if they're noticing their children develops a rash, develops abdominal pain, vomiting, or diarrhea, that they contact their pediatrician or their family medicine doctor, and then they can guide them in terms of either to come in for evaluation or to what they need to do in terms of monitoring the child's symptoms. So for now, it has not been many cases. We are seeing some, but we are recommending the same things. We are open and we are seeing children. And so we're able to, if something worsens with the child's symptoms, we're able to quickly bring them in for assessment and treatment if need be. We don't want people staying at home. If the child is sick, they should be bringing them in to be seen and evaluated. So the biggest thing for us is making sure that people are aware of these symptoms, and if they do see them, to contact their healthcare provider, and then they can guide them in terms of what to do next.
Well, no death has been recorded from these symptoms yet, but can this be fatal?
Potentially. I mean, I think if it has if the inflammatory response and the syndrome causes significant compromise to the heart and lungs, and we're not able to be able to counteract that, then yes. But we have a lot of treatment options available to be able to manage any kind of heart failure, any kind of respiratory failure. And so, we're very skilled in terms of taking care of children who have significant complications like this. So I don't anticipate, but we have to wait and see. But we'll be able to manage any complications that children have.
So like you rightly said, there is a lockdown in almost almost all parts of the country. Some states have reopened their economy, but children at home. But President Trump is looking to reopen as quick as possible, get children back to school. Like I also said earlier, there are 74 million children younger than 18 in the U.S. What could be the implication of this for them if they were to return to school?
So I think for now, we need to reassure folks like this is happening in a small subset of individuals and certain children. We're studying to be able to get a sense in terms of how many children this is being impacted. And I think the remaining, the same symptoms that we're telling people to contact their doctors. So if the child has fever, if they've got cough, if they've got difficulty breathing, belly pain, vomiting, diarrhea, any of those things that people should then reach out to their provider to get guidance. I don't think for now, I know that our schools are not going to be open likely until the fall, but we're waiting to see what the governor recommends. I think for now, that's a wise decision because we know that there's still community spread of this virus and we don't want more children and families to be impacted. So I think the wise thing is for us to continue to have folks stay at home, continue to do hand hygiene, continue to be able to do social distancing and stay away from large crowds for right now.
All right.
And be able to be.
All right, Dr. Suzette, just a minute. I'd like to bring in, we have Oyiza joining us now, also from New York. Oyiza, you are a journalist, so what more can you tell us about this situation with children in New York? Oyiza, what more can you tell us? What's the latest on this situation with children in New York coming up with this inflammatory syndrome? All right, we lost connection with Oyiza. Back to Dr. Suzette. Dr. Suzette, let me just ask, is this infectious or is this contagious?
So we know that there's a relationship to COVID-19, and that is infectious. So we know that this is related to COVID-19. At least so far, the preliminary reports are showing this association. So we are just recommending, I want to just reiterate, the signs that we normally see in terms of a COVID-19, in terms of fever, cough, runny nose, in terms of shortness of breath. Those things are still things you want to look out for in children. And then this inflammatory syndrome, the other symptoms are rash, abdominal pain, vomiting, and diarrhea. So that's the other symptoms that could be associated with this inflammatory syndrome.
Professor of Pediatrics at Albert Einstein College of Medicine, Suzette Oyeku, many thanks for speaking to TVC News.